Now that we have successfully made it through pregnancy, it's time to give birth. Chapter 4, Birth and Physical Development during the first 3 years, is where we are about to go. Let's start with our learning objectives. By the end of this chapter, you should be able to specify how childbirth has changed in developed countries, describe the birth process, describe the adjustment of a healthy newborn and the techniques for assessing its health, explain potential complications of childbirth and the products for infants with complicated births, identify factors affecting infants' chances for survival and health, discuss the patterns of physical growth and development in infancy, and describe infants' motor development. If you haven't already done so, you should stop and read the chapter before the lecture. As always, it's impossible to cover everything in the lecture that is available to you in the chapter, and having read the chapter first will enhance your understanding. There are many ways to talk about pregnancy. We talked about the 3 phases, but we could also talk about trimesters, which are dividing the birth into 3 equal months. The first 3 months, the second 3 months, and then the final 3 months. Pregnancy begins at conception, which starts the gestational age. Due to the way it is calculated, the due date is calculated using the last menstrual period, which would be at least 14 days before conception. A baby is considered full term up to 2 weeks before and 1 week after the due date. As always, let's begin with a little bit of review. What do you call a baby born 3 weeks early? If you said preterm, that is correct. Childbirth is not risk-free. I was in Mass one time when I lived in St. Louis, and an elderly priest was speaking or presiding, and he said that pregnancy was a sign of vigorous good health. It is rare that I stay after Mass to correct the error of a priest. In fact, I think this was the only time that I have ever done so in my life. But pregnancy is not a sign of vigorous good health. It is only a sign of fertility. Women die in childbirth every single day. Prior to the 20th century, birthing was almost always tied to culture, and it tended to be similar for most women in a given culture. In 1900, only 5% of births occurred in a hospital, and by 1920, it was 65%. They primarily used midwives at that time, and many of those midwives were not trained the way that we train midwives today. The death rates were higher for both the mother and the baby, and 1 in 4 babies died in the first year. By the 20th century, a dramatic reduction in deaths took place due to antibiotics and prenatal care. And birthing became more medicalized, but still was not risk-free. Childbirth remains dangerous in many developing countries. 50,000 women per year in the U.S. experience life-threatening events during pregnancy. And while you can see that the deaths per 1,000 live births of infants has steadily decreased, the maternal mortality rate in the U.S. has not seen the same decrease. In fact, until the early 2000s, it continued to increase, and it remains high. Among industrialized countries, we are almost always the worst. There are 3 stages of childbirth. Let's review. Dilation of the cervix is generally the longest stage. It's 12 to 14 hours. The contractions begin about 15 to 20 minutes apart, and at the end of this phase are only about 2 to 5 minutes apart. In stage 2, this lasts about 1 to 2 hours as the baby descends and emerges. And stage 3 is the delivery of the placenta and the umbilical cord, which takes 10 minutes to 1 hour. This is another graphic that shows you the process. And if you start at the top left, you will notice that it's showing you the process of cervical dilation and presentation of the head. Then it's showing you the child proceeding through the birth canal, and then finally the delivery of the umbilical cord and the placenta. We tend to do electronic fetal monitoring on many pregnancies now. Due to the risk of labor and delivery, technologies are used to monitor the fetus. One of these is electronic monitoring that can track the fetus's heart during delivery, providing valuable information on how the heart is responding during contractions. It is especially useful in high-risk pregnancies. For the most part, most places use a monitoring belt around the abdomen, and it's detecting the heart rate of the baby. In 2004, fetal monitoring was used in 89% of live births in the United States. One of the disadvantages of using the electronic fetal monitoring is a high false positive rate, and that can result in unnecessary cesarean sections. So a cesarean delivery involves surgically removing the baby through an incision in the abdomen. Over 30% of all U.S. births are cesarean deliveries, but they have declined from 32.9% in 2009 to 31.9% in 2018. And the rate varies greatly by country. Cesareans tend to be more common when labor progresses too slowly, and for first-time mothers who are older or who have had prior C-sections. Let's talk a little bit about size and appearance. The neonatal period is the first 4 weeks of life. The baby is transitioning from the intrauterine environment, where it's fully supported and dependent on mom, to an independent existence. In the United States, a neonate is about 20 inches long and 7.5 pounds at birth. You should stop here, and if you don't know this, you should call your own mom and talk to her about her birth experience. I bet you to this day she can tell you when her babies were born, how long they were, and how much each of them weighed. After the baby is born, it's going to lose about 10% of its weight by the 5th day, but it will gain it back by 14 days. The other unique feature is that the baby has fontanelles, and these are soft spots between the skull bones that make it easier for it to pass through the vaginal canal. By around 18 months, these fontanelles, they gradually fuse together. APGARs are done at 1 minute and 5 minutes after birth. What you're hoping for is a score between 7 to 10, which is considered good. 5 to 7, the baby needs assistance, and 0 to 4, the baby needs immediate life-saving treatment. Let's talk a little bit about how this works. If you look at these, you will see appearance, pulse, grimace, activity, and respiration. And up at the top, you see scores, 0, 1, and 2. The way you get the numbers is you add up the scores. If the baby has no blue coloration, then it gets a score of 2. A heartbeat greater than 100, a score of 2. If it's sneezing, coughing, or pulling away when stimulated, a score of 2. If it has active movement, a score of 2, and a strong cry, a score of 2. If it has any of the features in column 1, score of 1, and then you add all of these up, and that comes up to your total score. You ideally want to score between 7 and 10. Let's talk about the stages of arousal. An infant's state of arousal is measured in terms of eyes, breathing, movement, and responsiveness. Newborn sleep alternates between quiet, which is considered regular, and active or irregular sleep. Some of the complications of childbirth include low birth weight. Babies, low birth weight is less than 2,500 grams or 5.5 pounds. Worldwide, about 14.6% of babies are considered low birth weight. Preterm infants born before completing the 37th week of gestation are more likely to be low birth weight. Preterm birth is involved in nearly half of all neurological defects. Let's talk a little bit more, though, about low birth weight. It isn't just one category. We know that 14.6% of all infants worldwide are born with low birth weight. The rate is higher in underdeveloped countries than it is in the U.S. Here, the rate is about 8%. The major contributor to low birth weight is poor maternal nutrition. However, in industrialized countries, it is usually due to advanced maternal age, smoking, and multiple births. We also have very low birth weight babies, which are under 1,500 grams or 3 pounds 5 ounces, and extremely low birth weight babies, which are under 1,000 grams or 2 pounds and 3 ounces. Maternal factors do impact low birth weight. Other factors that increase the likelihood that a woman will have an underweight baby include demographic and socioeconomic factors, such as being between the ages of less than 15 or over 35, being unmarried, and lack of education and income. Some of the individual factors are prior low birth weight babies and miscarriages. And prenatal behaviors and environmental factors include things like poor nutrition, the smoking, drinking, or drugs, high altitude. Some medical conditions also can lead to low birth weight babies, such as infections, high or low blood pressure, and anemia. There are long-term outcomes that we need to consider. Later in life, low birth weight babies are at greater risk for high blood pressure, adult onset diabetes, and cardiovascular disease. They have a higher risk of death from infancy to adulthood. Extremely low birth weight babies are more likely to have neurological and cognitive impairments, lower academic achievement, and social and behavioral attention problems. Postmaturity and stillbirth is another issue to think about. Babies can be negatively impacted by staying in the womb too long. 5.9% of U.S. women have not gone into labor after 41 or more weeks, leading to a post-mature baby. And a post-mature baby also tends to be a larger baby. Some of the results of that can include shoulder dystocia, myocardium aspiration, low Apgar scores, brain damage, and even death. A stillbirth is the sudden death of a fetus at or after the 20th week of gestation. Before that, remember, it is called a miscarriage. In 2018, 2.6 million fetuses were stillborn. The rate is 10 times higher in low and middle income countries. And it's not equal. Boys, non-Hispanic black fetuses, and twins are more likely to be stillborn. We must address some of the disparities we see in our healthcare system. There are ways that we can work to reduce infant mortality. In 2018, there were 5.3 million worldwide deaths of children of 5 years of age and younger. The majority were 28 days or younger. The chief cause were preterm complications, which was 35%. Childbirth complications, which was 24%, and sepsis, which accounted for 15%. Let me show this to you in a graphic. This is the leading causes of unintentional injury and death of children 0 to 19. And I'm really wanting you to only look at the first column to the left, which is the less than 1 year of age. Unintentional injuries are the 5th leading cause of death in infancy in the U.S. The 5 leading causes are suffocation, motor vehicle accidents, drowning, residential burns or fires, and falls. Infant mortality has declined for all races and ethnic groups in the U.S., but large disparities remain. Black babies are nearly 1.5 times as likely to die in the first year as white and Hispanic babies. One of the things we can do to protect babies and their health is immunizations. Immunizations provide for a better life. Worldwide, 86%, or 116 million children, are immunized in their first year. In the U.S., 90% of children 19 to 35 months have received recommended vaccinations. This has significantly decreased in the last couple of years during COVID, and that number is much lower now. The country allows exemptions for religious and philosophical reasons. Sadly, in our current political climate, people have used this as an opportunity to politicize vaccinations. This should never be done. Some parents hesitate to immunize their children, but there is no, and let me repeat this, no causal link between vaccinations and autism or other disorders. In fact, the immune system is fortified by vaccines. People who are saying otherwise are spreading false information, period. Development is cephalocaudal and proximal distal, which you may be able to notice in these pictures. And I told you I was going to repeat this, so I am. The cephalocaudal principle describes development in a head-to-tail direction. The upper parts of the body develop before the trunk. In the womb, the head and trunk develop before the arms and legs, then the hands and feet, and then the fingers and toes. It also develops according to the proximate distal principle, or growth and motor development proceed from the center of the body outward. Take a look at the babies. So, first, you will notice the head is huge and the middle of the torso huge compared to everything else. And then the body gets longer, and if you see the newborn, the head is out of proportion still to the rest of the body. You will notice that the body catches up, the arms and the legs catch up with the head. And this is just a good way to try to remember it. So take a look at the picture and try to use the picture to help you remember both cephalocaudal principle and the proximate distal principle. Wanted to provide you a growth chart, and this is a growth chart for boys. There are separate growth charts for girls because obviously the rate of growth and the size within the normal range is different. But children grow faster during the first 3 years, especially during the first few months, than they ever will again. Children in developed countries are growing taller and maturing at an earlier age than children did a century ago, probably due to things like better nutrition and improved sanitation and medical care, and a decrease in child labor. When you see infants, we tend to now do this electronically, but what you will do is you will actually track a child and monitor them based on their growth. So one of the things you will do is you will go in and you will look at the length of the child in centimeters, and then you will look at the age. So if I wanted, and this is the length and down below is the weight, but if I said I wanted to look at a child and I am looking at a 3-month-old, and I'm going to say that this 3-month-old is about 23 centimeters, I would put a dot here. And if you look at this line then tells you that it is in the 50th percentile. Okay? You can look at these and it will help you along the way. One of the ways that new moms can help their babies is through breastfeeding. And you have in table 4.2 in your books why you should breastfeed babies, and it talks about the benefits. So the benefits for the babies and the benefits for the mothers. The babies are less likely to contract illnesses such as diarrhea, respiratory infections, otitis media, sepsis, bacterial disease, and urinary tract infections. They have a lower risk of sudden infant death syndrome. They perform better on IQ and cognitive tests. They are less likely to develop obesity, diabetes, and childhood cancer. And they have fewer cavities. For the moms, they tend to recover quickly from childbirth with less postpartum bleeding and are more likely to return to their pre-pregnancy weight and less likely to develop long-term obesity. They have reduced risk of anemia, and they are less likely to develop osteoporosis or ovarian cancer and premenopausal breast cancer. So, breastfeeding is good for both mom and baby. We want the babies to develop healthy brains. And a healthy brain isn't just genetics. There's a lot of it that's environmental. But you need to understand the normal development. The left hemisphere is mainly concerned with language and logical thinking, while the right hemisphere is visual and spatial functioning, like map reading. It is important for you to learn what each portion of the brain does. As a nurse, if there is damage to a portion of the brain, You will see it in symptoms of your patients. If a person has a stroke that impacts the left hemisphere, you may see language impacted. It's really important to read all of this in your textbook. There's way more detail than I will provide you here. Brain development begins about 3 weeks after conception. The brain development is lifelong. At birth, it's only about a fourth to a third of its adult size, but by age 6, it's almost at full adult size. The brain and the spinal cord make up the central nervous system. The brain's growth occurs in fits and spurts called brain growth spurts. Different parts of the brain develop more rapidly at different times, including the brainstem, which is responsible for regulation, the cerebellum, which is responsible for muscle coordination, the cerebrum, which is the largest portion of the brain, and the corpus callosum, which joins the right and the left hemisphere and allows them to share information. The human brain is divided into 4 lobes. The occipital lobe, which is related to visual processing, the parietal lobe, which controls sensory integration, the temporal lobe, which interprets smells and sounds and is involved in memory, and the frontal lobe, which does higher order processing like inhibition and planning. Again, please read your textbook carefully. This is important information for you to learn, as you will be expected to know it in future classes. Let's talk a little bit about the brain cells. So we've gone from bigger to smaller. The brain is composed of neurons that send and receive information and glial cells that nourish and protect the neurons. They are essentially support systems. At about 2 months after conception, about 250,000 neurons are produced every minute. They are not only growing in number, but they're also growing in size. Through integration, neurons that control various groups of muscles coordinate their activities. Through differentiation, neurons take on a specific specialized structure and function. In brain development, cell death is a normal elimination of excess brain cells to achieve essential functioning and to achieve efficient functioning. Let's look at a little bit of the human reflexes. So, reflex behavior is automatic. It initiates responses to stimuli. Human infants have 27 major reflexes, and I am not going to go over all of those, including primitive reflexes like sucking. Most early reflexes disappear at 6 to 12 months, and others like blinking and yawning remain forever. The moral reflex is if the baby is dropped or hears a loud noise, it tends to extend its arms and legs and fingers and arches back and draws its head back. This tends to disappear at about 3 months. The grasping reflex, when the baby hand is stroked, it will grab onto whatever is stroking it, and it makes a strong fist. It can be raised to a standing position if both fists are used. This tends to go away about 4 months. One of the others that is common that you will see is the Babinski. And the Babinski is if you rub something on the sole of the foot, if you stroke it with like your fingernail or a pen, like a pen you write with, not a needle. then the toes of the foot, they tend to fan out. So imagine if you took your fingers and you spread that out as far as you can. That's kind of what the toes of the baby do. And this is a normal response for a baby until about 4 months old. It is an abnormal response after that, and it's certainly an abnormal response in adults. You'll also see rooting, and if the baby's cheeks or lips are stroked, its head turns and its mouth opens, and this is really to prepare for sucking and for feeding. This tends to go away at about 9 months old. And one of the ones that's always interesting to new parents is swimming. If babies are put in the water face down, they make well-coordinated swimming movements. This tends to go away by about 4 months old. The brain is moldable, and it's moldable by experience. Our brains change as we develop, and they are impacted by not only the genetics that came to us from our parents, but also by the environment we are in. The malleability of the brain is referred to as plasticity, and this enables learning. The environment is important for brain function, and we're going to talk about this a whole lot later as we talk about not only the growth and development and learning of children, but also how important it is to have an environment that helps you function even as you get older and continues to stimulate your brain. Some of the early senses that we have are touch, smell, hearing, and sight. Touch is the first sense to develop in the womb. Newborns can and do feel pain. For the first few months, it is the dominant sense, touch, not pain. Smell and taste also began to develop in the womb. A preference for taste and smells can be learned in utero and through breast milk. In other words, they are smelling and tasting what mom eats. Hearing is also functional before birth. Fetuses can tell new speech patterns from those that they've heard before. Sound heard in the womb may be the foundation of the relationships with mom. They've been hearing her for 9 months, so they already know her voice. And then sight is the last that's developed, and it is developed at birth. Visual acuity is only about 2,400, but it improves rapidly. At birth, infants only focus about a foot away, which is why when you see so many people holding babies so close, this is important for the baby. That's what they're seeing. One of the things we do is we chart motor skill progress. Babies combine simple motor skills into increasingly complex systems of actions. One of the ways this is tested is through something referred to as the Denver Developmental Screening Test. And it charts motor skills process between ages of 1 month and 6 years to identify children who are not developing normally. What the test does is it measures gross motor skills involving large muscle groups, such as rolling over, and fine motor skills that use small muscles, like grasping a rattle. It also measures language, personality, and social development. Those are newer measures that have been added to the test. Now, let's look at Table 4.4, which shows you the milestones of motor development. When you think of the milestones of a baby, we're really talking about an average baby. We mean 50% of the Denver norms. Obviously, being outside the average does not mean abnormal, but it does mean that one should look for a reason why. Motor development occurs in a systematic manner. A baby masters one task before moving on to another. You can't walk before you can pull up, for example. You can't pull up before you can roll over. If you look at this, you roll over at about, if you look at the 50th percentile and the 90th percentile. Let's just look at the 50th. Most babies roll over at a little over 3 months. After that, they can grasp or rattle. By about 5.9 months or 6 months, they're sitting up without support. At 7 months, they're standing while holding on. 8.2 months, they grasp with the thumb and the fingers. 11 months, they're standing alone well. At 12.3 months, they're walking well. At 14.8 months, they're building a tower of 2 cubes. And at 16.6 months, they're walking up steps. That's when you start getting in trouble. But that's when you have to start really watching them. They can get away, but they are still not stable, and they will fall frequently. 2 of the theories, and I apologize for ending the lecture on theories. I know it's not people's favorite part, but it's important to understand. And we're going to discuss 2 theories real quickly. The ecological theory of perception, and this is always, it's somewhat amusing to me. It probably shouldn't be. But the visual cliff studies provided an illusion of depth to assess depth perception in children. And they wanted to see if babies would crawl over the deep end of a cliff if mom encouraged them to do so. The findings led to the ecological theory of perception, which is that developing motor and perceptual abilities are interdependent and a part of the functional system guiding behavior in varying contexts. Each new environment provides a new challenge for the babies to master. Your second theory for this week is the dynamic systems theory. Esther Thalen argued that behavior emerges in the moment from the self-organization of multiple components. The maturing brain is just one component in the dynamic process of learning. It is a theory that's grounded in nonlinear systems principles that attempts to explain behavior and personality in terms of constantly changing, self-organizing interactions among many organismic and environmental factors that operate on multiple timescales and levels of analysis. What this means is that learning occurs through detecting the many features of an environment. With experiences, babies learn to gauge their environment. Is that mall moving away from me? Is that ground too rough to walk on? Thank you for paying attention to this lecture and for viewing it. For my students, as always, please feel free to join me in office hours. You know my email, you know my cell phone number. I'm really good at responding to text messages. And I hope you enjoy your studies this week.